Elevated blood pressure or hypertension is the most significant contributor to complications such as heart disease, stroke, peripheral vascular disease, and kidney failure. The consequences of these complications are devastating and deadly. It is important to remember that hypertension is the most significant preventable cause of cardiovascular and renal complications and premature death. It is the responsibility of the provider and members of the healthcare team to use a collaborative approach with proper blood pressure technique, education, understanding of the disease process, medication adherence, lifestyle changes, and the importance of data in hypertension population control. This is increasingly important with the newly released blood pressure guidelines. This series is designed to assist clinical teams to utilize a systematic approach to improve processes in their practices to ultimately improve blood pressure control. Welcome to Session 7. Each session builds on one another, so it may be beneficial to view them in order. The last sessions have focused on the principles and some of the tools related to performance improvement. The principles and tools form a base for improving any process or outcome. This session discusses how to determine the first intervention, plan, test, study, and then put into the practice routine. Likely by now, the team has begun or finished their workflow redesign process. The team has an idea of the causes of hypertension. Now, it is time to put all that work into identifying ways to improve uncontrolled blood pressure. A team working on performance improvement has many ideas for interventions that will make a difference. Often, however, team members may have conflicting ideas of how to prioritize and what intervention should start the improvement. In a previous session, brainstorming was encouraged as a tool to generate many ideas fast. Using the flip chart and colored markers, the scribe will jot ideas for interventions. Using different colors for each idea helps differentiate one from another. Remember, no idea is a bad idea, and extraordinary ones are invited at this point. Keep going until the team has no more ideas. Nominal group technique, like brainstorming, generates ideas but prioritizes them according to team members' views. Each team member takes 5 to 10 minutes to jot down as many ideas and the priority the team members view them. Like brainstorming, the scribe captures the ideas onto the flip chart as the team members call them out. Be prepared for many ideas for how to improve. Because teams usually define a fairly long list, the team needs to define some criteria for choosing the first intervention and moving forward. Just like picking the fruit of a tree in closest reach, the first several interventions are usually called the low-hanging fruit because they are easy to implement, don't cost much or anything at all, and gets the biggest bang for the buck. Should the team have come up with a long list of ideas for improvement, a tool called multi-voting reduces a long list of items into a more manageable number using a series of votes. The end result is a short list identifying what intervention is most important to the team. That is, selecting the first intervention to plan and test. Of note, if the team's list is already fairly manageable and reasonable, this step can be skipped. Here's an example of lists of ideas for interventions. The process is as follows. Assign a letter to each idea. Each team member selects the most important 1 through 3rd. In this case, team members would get 3 votes. Each team member may cast only 1 vote per idea and must cast all allotted votes. Voting may be done by paper ballot, raising of hands, but the favorite among many teams is for each team member to come up to the flip chart and put a tally by 3 ideas. For this example, there are 4 team members able to cast a vote of 12 votes. A rule of thumb: if 5 members of a team or fewer, eliminate 0, 1, or 2 votes. For our case, we will eliminate those with 0 or 1 vote. If 6 to 15 members, eliminate 3 or fewer votes. If more than 15 members, eliminate 4 or fewer votes. After the first few possible solutions have been voted on, the higher ones are listed and then the team votes on priorities for implementations. In this example, each team member gets to put in 1 tally for their first priority, 2 tallies for the second, and 3 for the third. This go around, the lower number is the intervention that begins improvement. This may seem counterintuitive, but consider number 1 priority, and that helps with understanding. Of note, many good ideas did not make the cut. These can be reevaluated after the first 4 interventions are tested, studied, and put into practice. It is a good idea not to try and implement a lot of interventions at one time to avoid frustration. In our example, the team thought that the purchase and use of different sizes of cuffs was the most important to start with. Planning begins. Once the cuffs are in place and being used, it is perfectly fine to plan another. Simply go through the ranking order process again. Other interventions can be considered moving forward. Home blood pressure monitoring requires patient training should occur under medical supervision. Devices validated, support storage of readings, and cuff size appropriate. Verify left or right interarm differences are insignificant. If differences are significant, instructions given for patient to use arm with the highest reading. Follow the same recommendations as used in office, in other words, position, sitting still for 5 minutes, etc. Take 2 readings, 1 minute apart in the morning before medication and evening before dinner. Record readings accurately. It is a good idea to build this function into a workflow or process map. To summarize, decision-making tools narrow a long list. Decision-making tools prioritize interventions. Plan, do, study, act sets the intervention into motion. Home blood pressure monitoring is recommended with proper education. Home blood pressure monitoring can identify white coat syndrome. In any performance improvement activity, don't be afraid to take the time and effort to really sniff things out. Put yourself in the place of the patient. Look downstream to define what is going on upstream. Thanks for joining our Hypertension Performance Improvement Project. Happy hypertension performance improving!